Hello, my name is Kelly Matthews, and I am a pharmacist and Director of Clinical Services at Avella Specialty Pharmacy. Avella rotation allows for students to be integrated in a variety of patient care opportunities, increase exposure in specialty pharmacy, and learn about specialty disease states and therapy management. As the specialty pharmacy market has continued to grow, Avella has identified an increased need to enhance student knowledge during didactics to the specialty disease states and contracted management programs that these medications often require. Last year, I worked at the local College of Pharmacy, Midwestern University, Glendale campus to develop and implement a 10-week elective class into didactic learning. It's titled Introduction to Specialty Pharmacy. The goal of the class is to focus on specialty disease states and patient management in areas such as inflammatory, targeted oral oncology agents, hepatitis C, and HIV. We have invited Dr. Mike Dietrich, Assistant Dean of Professional Programs at Midwestern University Glendale campus, to discuss the unique partnership with Avella Specialty Pharmacy and Midwestern.
I'm Mike Dietrich. I'm the Associate Dean of Professional Programs here at Midwestern University College of Pharmacy in Glendale. Midwestern has a unique and kind of novel three-year curriculum where we integrate both pathophysiology, medicinal chemistry, pharmacology, and therapeutics into the same course. In that course, we take different disease states and introduce those topics along the way, and in those topics, we do introduce the specialty topics. We do a good job of integrating with the current specialty medications, but we are a little bit behind in doing what's the next generation of specialty medications, because it could be 5-10 years before some of these hit the market. What we do specifically is try to train students the skills so that they can learn to incorporate those into their practice when they do come out. We've worked with Avella and we've developed an elective to help with that, and also with our rotation students who are out on their experiential portion of the curriculum. But in our required curriculum, we just simply introduce them along with the disease states, so there's no real focus on any one of them, and I think that's an area that we certainly would like to look at in developing, and an area to introduce them a little bit more concretely. The lecturers are credentialed as faculty members through the university, and they're experts in the disease topic area, but not necessarily in any one of the different medications, especially medications. We are aware that many of them require quite a bit more education in detail, and some require certification even to work with. So we do reach out to folks like Avella and other companies to fill that need. I think the gaps may have been covered in the previous question, and that's certainly not having someone on faculty full-time who is certified or understands the topics as in-depthly as someone who would work in a specialty area. Well, I think that's the primary strategy we're going to try to employ, and I know we've done that now with the elective, and we're also seeing that with the students who've now registered for their advanced rotations, and we'll see how that pans out. We're still developing that. The elective class is certainly the first step, and that's the best way to go initially, because that's how you get the comfort level with the person coming in and helping with teaching. Then you get the comfort level with a topic that we may not teach as extensively, and then we move into having that taught at the experiential level. I think reaching out to them through our state society, the Arizona Pharmacists Association or Pharmacy Association, would be primary, because we don't have a specialty group within that organization, but we could have a special interest group that deals with specialty pharmacy, and that would be another ideal way to reach out and stay connected with folks who may be interested. We have a lot of assessment tools, and we do a lot of assessment here at the college, but to understand if we were successful in that, I think it's more about the generation of interest. How many people are interested in doing the elective? How many people are interested in doing the rotation sequence? If that number is growing, then we're doing a good job, then we're doing what we need to do. I think it's going to help the entire curriculum by learning that there are more than just a few areas of pharmacy. Many students come to us knowing community pharmacy or retail pharmacy, knowing hospital pharmacy, but not knowing the breadth of different types of practices, and that some of them overlap. But this is just another one of those pathways, and with Avella being growing and being a large part of the Valley and also many other areas in the country, they have a lot of opportunity. Specialty pharmacy allows you to tailor that medication to the patient. And as we get better at that, we are able to integrate other disciplines in. It is really the future, and I think there's going to be a greater interest in the area. I think technology is the key to proving to the payers that the efforts of pharmacy, that the efforts of the healthcare team paid off, that the patient stays engaged. You can keep the patient engaged and keep them wanting to come back and take their medication. You keep the healthcare professional engaged by educating them. You use tools and technology to do that, and you begin to integrate the entire health system. We're trying to do many of those things across the entire profession of pharmacy, but in specialty pharmacy it's critically needed.
Thank you for watching this video. We are excited about our continuing partnership between Avella and Midwestern University, how it is enhancing specialty pharmacy education, and what the future curriculum may entail.